The most rewarding part about working at Uinta is watching the families grow and watching the relationships grow stronger and better. When they leave, they are usually so full of hope and optimism and self-assurance. It's just one of the best things ever to see.
Our students at Uinta primarily have intensive trauma and attachment issues, generalized anxiety disorder, depression, and various struggles with different maladaptive coping mechanisms.
They've been through a lot of treatment before they get here, and this is the one we hope is the last place for them.
Many of them just have complex family system issues, and so we work with the families from an intensive family systems perspective, as well as work with the individuals through DBT, CBT, EMDR, brain spotting. Our hallmark is equine therapy.
The lovely thing about using equine horses for our therapy is that they are a mirror. Once we can get the client to understand that the horse is mirroring their emotion, it's a lot easier to make a connection and to help the client understand how they are presenting. It's really quite cool.
We have therapists who are familiar and work from an ACT therapy approach, an acceptance, value-based, and commitment approach. We have an adoptions closed group, a chemical dependency, and a sexual trauma, as well as a bereavement group. We have a trauma-informed yoga. Our clinicians and our trauma-informed yoga specialist will help our students mindfully connect inside of themselves and learn distress tolerance skills to regulate and modulate their own emotions so that they can learn how to interact with those around them.
Most times these kids will leave an environment, like their home environment, because it wasn't working for them. That's usually where they started, either self-harming or having suicidal ideation or their depression. And if we can't change the environment, they're just gonna go right back to the same thing, and it's probably not gonna change. So we work really hard with the families so that they understand that they have work to do as well. We call it the parallel process. And then the families also go through their own treatment with their own therapist while they work with us. By the time we're done, everybody's in a much better place.
If I was talking to a parent considering to send their child to Uinta, I think that I would tell them to first and foremost just take care of yourself. It's a grueling process. They've done the best that they could. They need to place their child out of home just to keep them safe. So I think I would tell them to have grace in the process, while also inviting them to engage in the parallel process themselves.
I would bring my own child here if necessary. We can guarantee that we'll make them as safe as possible here.